Hello, FP Shaun Chen. My name is Anisha, and on behalf of the Morningside Heights Neighborhood Association, I'd like to thank you for taking the time to speak with me today.
Thank you so much, Anisha. Great to see you and really looking forward to our conversation.
So, today's discussion is going to focus mainly on COVID-19 and the impact on community wellness. And to start, I'd like to focus on the economic impact of the pandemic.
Right.
COVID-19 has created significant employment consequences. Over 1 million Canadians have lost their jobs. What resources is the federal government providing to support individuals and communities that are suffering from income loss?
Great question. I would say that since the beginning of this pandemic, our government has been quite proactive. We have put out a number of measures, one of which has been the Canada Emergency Response Benefit, and that CERB has allowed many Canadians who have lost their jobs, who have been unable to work, or have reduced hours during the pandemic to receive income support. The CERB has since been transitioned to an expanded EI, which makes it easier for more Canadians to get benefits. And we've also recently added three new benefits, the CRB, Canada Recovery Benefit, the Canada Recovery uh, caregiving benefit, and the Canada Recovery Sickness Benefit. And those three recovery benefits are very much targeted to the Canadians that need the most support. The sickness benefit, for example, are those who are unable to work because they are sick or they need to self-isolate because of possible exposure, or they are positive for COVID-19. The caregiver benefit, we heard from so many Canadians who have children who are unable to go to daycare or school, or have other dependents that they need to provide care for. For example, seniors who are living at home. There is a benefit there that allows Canadians to receive money so that they can stay home for a short period of time to provide that care. And then we know that some of the Canadians who have not been able to access CERB or what is now the extended EI because they are self-employed, or have employment through other circumstances, that Canada Recovery Benefit will help them. And combined, these measures are getting Canadians back on their feet. The good thing is that the recent job numbers show that over 2.3 million Canadians have now returned to work since the start of the pandemic. However, with that great news, still a lot are suffering. So we're doing our best to make sure that the new measures are coming out and that we continue to support those who need the most help.
So, local businesses have been deeply affected by COVID-19. How important would you say it is to shop locally during the pandemic?
It's so very important. And in fact, I've been trying to do that. If you've seen some of my social media posts, I've been going out to support our local coffee shops, our local restaurants, and some of the other areas, convenience stores that have been hit the most hard. We know how difficult this is on local businesses, but at the same time, we can't just stand by and let them falter. Our small and medium-sized enterprises are the bedrock of our Canadian economy. They produce jobs, they allow communities to thrive. And especially in our riding, Scarborough North, we have so many mom and pops, restaurants, takeout places. You can get some good deals, five for a dollar samosas. We all know how wonderful our mom and pop stores are, and we got to support them. So that's why our government has been doing that through efforts like the wage subsidy, which is allowing employers to get money so that they can either keep their staff on the payroll or recall them if they've been let go. And we need to be able to support those local establishments. I've been fortunate now that I'm doing a lot of things virtually. I'm not in Ottawa, so it's great. I've been trying a lot of local shops and doing my best. But at the same time, we have to be careful. I know that the province has just put in a new order for certain regions in Ontario, and I know that, for example, our restaurants and bars are going to be closed. However, they can still open for takeouts. So I think if you can't sit inside or even now on a patio, if that's the case, then well. it's getting cold. Why not just hop in, grab some takeout, and you can enjoy it at home. And it's a great way to support our local economy.
Absolutely. Shifting gears now to mental wellness in the community. This past October 10th was World Mental Health Day. What are some ongoing resources that are available for individuals in the community that are struggling with mental wellness as cases continue to rise?
Right. And I think this Anisha is going to be a big challenge for everybody. Mental health is a big issue. We know that, but especially given what's happened over the past 8, 9 months, many Canadians have suffered. Businesses have faltered. We have seen our most vulnerable, our seniors, and those with medical conditions suffer the most. And it's a challenging time. We need to be there for each other. And thankfully, I have to say, we have a incredibly resilient community. I've heard from so many people who have told me how it has been challenging, but also an opportunity for all of us to come together. And whether that's the services that are being provided through many of the community organizations, our government created an emergency community support fund in order to address some of those challenges. Seniors who are isolated, for example, they have been benefiting from programs that engage them virtually. There have been young people delivering food to our elders, helping them with groceries. There have been people giving back, and sometimes all it takes is just that interaction, and to know that somebody is there to provide that care. Because for a senior who has very little choice but to remain isolated and at home, it can be quite devastating for their mental health. So through that emergency community support fund, which has been going out to community organizations, as well as our New Horizons for Seniors funding, that's enabled organizations like Frontline and Chinese Cultural Center and many others across the riding to deliver programs on the ground so that seniors remain engaged. But overall, mental health is important, not just for seniors, but for everybody. We have a new program called Wellness Together Canada, and that allows individuals to get connected to resources, support, counseling, and this is funded through our federal government. So we understand how important that is for Canadians, and I encourage people to check out that website, that portal. The website link is ca.portal.gs, and there are resources there available for Canadians should they need it. There's also a service called Crisis Services Canada, and that's available to any Canadian that seeks support. So if you know somebody who is thinking about suicide, or you yourself might need support, there is a Canada Suicide Prevention Service, 1-833-456-4566. That's available 24/7, and Kids Help Phone is also available. Of course, our government supports these initiatives and provides funding. Kids Help Phone is available at 1-800-668-6868. So there's a few resources there available, but at the end of the day, we've got to take care of each other, and it's only by addressing those root causes of mental health issues. When we talk about, for example, the anti-Black systemic racism, or tackling anti-Asian racism, or any form of hatred, racism, and discrimination against any community, our Indigenous communities, it's important that we all understand that there are underlying causes, whether it's hate, discrimination, or poverty. We know that poverty affects people's mental health because they are unable to secure that job or access a safe a shelter, a place to live. So we need to ensure that we also at the same time address those root causes of the mental health issues that Canadians face.
Shifting gears now to recreational opportunities, COVID-19 has encouraged communities to get creative with recreational opportunities in the community. For example, Woodside Square, which is about a 10-minute drive from Morningside Heights, has hosted a variety of events throughout the past couple of months, such as drive-in movie screenings. How will Scarborough North continue to provide safe recreational opportunities as the weather continues to get colder?
Fantastic question. And I believe there's so many great things that are happening. I know a lot of organizations are doing their best to transition into a virtual way of delivering activities. And I certainly would encourage that. As I mentioned earlier, we have a number of funding streams that are available, whether it's the New Horizons program that is focused on seniors or the Emergency Community Support Fund that is through the three national agencies, including Red Cross and United Way Toronto. Those funding programs will help community organizations who typically provide some of these services to deliver them in a different way. We're encouraging them to apply because we want that money to get out and go to the people on the ground. And certainly we've seen some of that happen throughout our riding. You mentioned Woodside Square. There has been the drive-in movie project, and Asia-licious, which happens every year at Woodside. This year they turned into a virtual model, and we were able to get them federal funding, 50,000 for them through our emergency fund for cultural heritage and sport organizations, as well as the Heritage Canada Festivals funding. So they were able to use that money and do things virtually. Unfortunately, the part about the food, which is which is what Asia-licious is known for, you can't deliver the food through a computer, but they were able to do a lot of the cultural performances and also do a tribute to our frontline heroes. So those things can be delivered virtually, and it's great to see that a lot of the organizations are making that transition.
As we continue to self-isolate, seniors remain a very vulnerable demographic. You mentioned this a little bit earlier, but if you'd like to elaborate, what is Scarborough North doing differently to protect both the physical and mental well-being of seniors?
Fantastic question, because I get to tell you about some of the amazing things that we have been working on. It's been great to be here to do my best in trying to bring the community together. So one of the things I've been doing is helping to get meals out to our seniors, and there's a program, for example, with Daily Bread Food Bank, where they've produced meals. I've been out delivering some of those meals to the seniors. The Chinese Cultural Center has support through our federal government, the Emergency Community Support Fund, and they've been doing a Meals on Wheels program. So we've been going out to some of the buildings with a higher concentration of seniors. They must pre-register, but then we make sure they get a meal, and that happens every week. There's been businesses coming forward, and this has been one of my favorite things. When they come to me, I say, look, we've got a number of senior buildings in our riding. There's St. Peter and Paul residence, and there's also the Yi Hong Center. Those are seniors buildings, long-term care homes, as well as retirement home. So we've been able to give them food. A number of businesses have been just stepping up to do this. I have to give them some kudos. Grand Cinnamon Banquet Hall, they put together so many boxes of lunch that we delivered to Yi Hong. Uh, Yatung Hakka Chinese restaurant, they donated meals that we brought to St. Peter and Paul, and it's just been fantastic because the community has come together. But we need to be there and continue to do that, because our seniors are really relying on us, and they need the help. And there's a number of other more broader resources outside of what's been happening here. The Canada Red Cross, for example, through federal funding, has also been providing free grocery delivery to seniors. So there's a phone number that you can call, and if I can find it here, it's right here, 1-833-204 9952. That's for seniors or anybody who's in self-isolation without access to food. Red Cross will arrange food delivery to them. And of course, we have our food banks. Our Malvern Food Bank, Muslim Welfare Canada does a fantastic program, and they also do Meals on Wheels and Malvern Eats, and the Daily Bread Food Bank, which is operating out of the YMCA. So there's a number of resources. I would say if anybody knows somebody who who needs the help to connect with my office, and we can certainly help get them to the right people.
That's wonderful. And this brings us to our last question for today. The holiday season is going to look very different this year. What advice and resources do you have for families that are social distancing?
You know, we just went through Thanksgiving, and we had to make it very different. And of course, just yesterday we had Remembrance Day, and so for me, it is going to be different. We unfortunately are not able to do things as we normally would, but it's also been refreshing to see the new ways that we are connecting. And I know how important that it is for families and friends to gather during the Christmas and holiday time and the New Year's, but I know that we all value our health and we all value what our seniors and elders have done to contribute to building our great country. And in order to protect them and each and every Canadian, we have to make that sacrifice. It's so important that we continue to listen to the public health guidelines, that we follow what restrictions have been set in place, and those restrictions need to continue to be based on scientific fact and public health advice. And as long as we can continue to do that, we need to change the curve. The latest is not looking good. We had cases hovering at about the 900 to 1,000 mark, and I believe everyone was really hoping that it would go down from there. But unfortunately, we've now hit over 1,500. So we're seeing a significant increase in Ontario, and the only way to stop that second wave from going any higher is to ensure that we all physically distance, stay safe, wear a mask, practice proper hygiene, and make sure that we are not going into those large gatherings that are being prohibited right now. We have to stay safe, and make sure that we protect ourselves and our loved ones. So there are ways to connect, and I know that it's always a fun time and festive time to gather, but this holidays in the upcoming month will have to be a little different, and we all have to make that sacrifice for our long-term health and security.
Thank you so much for your time today, MP Shaun Chen. That brings us to the end of our discussion about COVID-19 and community wellness. Again, on behalf of the MHNA, thank you so much for your time.
Thank you so much, Anisha. Take care.